What's up, everybody? Thank you again for joining us for another episode with Dr. Assif. My name is Eugene. Eugene does hair. We also have Angela, creator, founder of Lady St. Lucia Lashes. And today is a part 2 of Botox and filler. We've got some interesting subtopics within that. Questions of where else you can get Botox. And there's things I'm sure I'm going to learn today. Doctor, go ahead and I guess, just get into it and tell us, like, where are some additional places besides the face that people get Botox, and why would they get them there?
Okay. So let's start with the first thing. I guess it's Botox is given for migraine headache.
Okay.
Everybody knows what is migraine headaches.
Yeah.
Actually, be honest with you, the insurance can pay for it, but you have to have documentation from neurologists though that you have more than 13 headaches a month. The frequency is more than 13 headaches a month.
Okay.
So you have, but it has to be documented by neurologists.
Okay.
And basically, that you can use it for migraine headache. And when you use it for the migraine headache, in a way, you give it this temporal area, you give it in frontal, temporal, and occipital area. You need about 120 units.
Oh, wow.
So 120 to 160 units, which is covered by the insurance. For the migraine headache, Botox works, but it usually doesn't work the first time. Usually it works after 3 to 6 treatments. So like every treatment's like, separated by 1 month. So kind of more, the studies have shown more treatment you do, more it gets better. Like if you do 1 treatment 1 month, then the next treatment, the second month, the third treatment, the third month. So it gets better with time. But it's been basically working good for patients with migraine headaches.
Okay.
It's really very good. In fact, a lot of my clients, when they come to me and they do like a Botox, they tell me, a lot of them, the headaches goes away. In fact, one of the side effects of the Botox is headaches. Some people, they get headaches from the Botox, but like for a few days, but a lot of the headaches will go away with time. And the reason why, because it just relaxes your muscle. When you give your Botox, your muscle relaxes. There's not that contractions in there, and also that can relieve that's really like a lot of people, they told me when I'm due to Botox, when they start getting headaches, hey, Dr. Assif, I'm start getting headaches, probably I'm due for Botox. Yeah.
That's me. That's how I know that I need because I started, I've experienced headaches since I was a little girl. And that is the one illness that I can't stand is headaches. So I will take as much Tylenol as I need to, or Advil or whatever. But when I started getting Botox, I realized that it really helped eliminate that. And then when I did start getting headaches, that was an indication that I needed to go get touched up. So for me, and I absolutely love it. I had a couple of questions. Now, I didn't know that you can actually get Botox in your armpits.
That's right.
To prevent sweating. Is that what it's for?
That it's right. So actually, Botox, you can give it every like in armpits in here. You can give it everywhere. You can in palms in your hands in there, over there. You can give it also.
Okay, I was gonna ask you that too.
Give it underarm over there. So you give it everywhere to sweat it, and the reason why because it stops the gland from making sweats. Okay. And actually, one of the things like the Botox will it's very popular. It's like the over the hand, palm of the hands, and the reason some people they really sweat so much they cannot even hold a paper, or they can write something. I've been with people that before they write they put like napkins or something or towel before they start writing because sweating of their palms, hands, palms. So basically it's really good. We do about in the hands over there we do about say about 60 units.
Wow.
Underarm is about the same thing. You need like about 60 in each, underarm for sweating.
How often do people get that? Like, what's the maintenance on Botox for sweating?
Yeah, it's a little bit of expensive. Usually, I would say every 6 months, like about twice a year.
Okay.
Like, yeah, that's like twice a year. And like some people, like, be honest with you, they sweat so much in there, especially they're working, like, guys wearing like shirts with ties and all that stuff, and when they come, so they kind of a little bit of um, that's Botox is a really good indication for this kind of people, like,
Okay.
the palms of the hands and the underarm.
Now, my next question is your body is ultimately meant to perspirate. It's supposed to help draw out, through sweating and stuff. So, in the case that someone does have Botox treatment and they're not sweating, is there any like negative fallback as to that, or
No, there is nothing because we sweat from everywhere. We don't
okay?
just perspirate from underarm. We perspirate from all over our body. Perspirates like all our skin. It just sometimes it is exaggerating sweating from underarm, which is kind of a little bit very annoying, and that's exaggerating sweat. You wear a shirt or t-shirt, you're all sweating. It doesn't look good, it is. Or you're sweating from your perspirating from your arm. So you basically sitting down. So actually, I have a friend of mine, which is his arm. It's like when he gets a little stressed out or something like that, his arm start like really like perspirating or sweating like crazy. He can't even like read newspaper because it's just kind of a little bit of get wet. So sometimes can get a little bit of very, very annoying, and that's really very good indication for Botox.
I actually learned that from my cousin. She's a TV chef in Korea, but growing up, she's played piano her entire life.
Yeah,
And she lived with me for a very short time. And so when she would teach me, piano, she would start sweating profusely from her palms. And
that's right.
stop to rub her
That's
palms
right. Yeah.
dry and continue. And so she had discovered that you could get Botox in your palms because it was so bad.
That's
Now,
right.
another thing that I discovered through her, and I didn't know this because I was fairly new to even just getting treatments on my face for Botox, but the mandibles, which you actually treated me last time on
That's
the
right.
jawline.
Yeah.
So that's meant to reduce the puffing.
Yeah. Well, actually, we call it there is two things. We call it the jaw Botox. We give it in the masseter over there. The masseter is in here, big muscle.
Yeah, mine are.
And actually, there is some ethnicities like Japan or kind of South Korea, kind of a little bit some they have a big masseter in here, and basically sometimes the big masseter is just like kind of people, they want to have that V shape of the face. They don't want to have that circular face. So when you give it, you get that V shape. But also, I think what I realize when people get Botox in the masseter, it does not just give them that very nice contouring face. But also when you have a big masseters, there is also you start cracking. Some people gives them like two kind of a little bit of we call bruxism. So they start like cracking their teeth, and and sometimes it's like too much kind of may destroy your teeth if you have a big master, because it can give you a little bit of be annoying for you. We call it bruxism, or we call kind of it's and also there is some people, they develop a big master from cracking their teeth all the time. It's like your muscle get bigger and bigger. And there's a lot of, actually, in fact, there's a lot of studies that a lot of women that they crack their teeth like that for stress or something like that. And when you start cracking your teeth, you make that master big without genetics. There is some genetics, like I said, some ethnicities, they have a big master genetically. We give them that nice face. Some other people, what they do, they start cracking their teeth or like that all the time. And with cracking your teeth, you make them, it's like you lifting weight. You're cracking that. So basically, you make that master big, and you do the jaw face. And actually, but also there is what we call, there's some people they have some, pain in the articulation between the mandible and the temporal area. They call temporomandibular area around this area over there. Okay,
That
so
kind of
also
TMJ.
TMJ. That's right.
Okay.
So the TMJ, and basically we do that. So we give Botox in the temporal area over there, and the master area. And there's some muscle over there, and we give it to there for TMJ. Also, like people, they have a lot of pain in this area. Sometimes because also the master, if it's big muscle, you can get like a pain or the TMJ, temporal mandibular area, kind of a little bit of that. So. But also be honest with you, beside the master, there is a jaw contouring. So you can give it like Botox to do contouring of the jaw. So beside the master, you give it around this area over there and around the platysma muscles around this area. So we call the jaw contouring beside the muscles. You give it around all this area. Okay. So. Yeah. So, like I said, there is a all indication for jaw contouring, for high, big master, for the jaw also contouring, or also TMG. So all these things you can give it for a Botox.
So there's multiple benefits to that. Not only does it give you a slimming jawline, but it also helps with the relaxation for any kind of TMJ issues and stuff like that. Now,
that's right.
Over time, when you continue to get treatment, does it eventually kind of just really like slim down your
That's right. Because all of the Botox, those muscles become, atrophic. So the muscles, like kind of when they don't work, they become very, very atrophic. So it's not a big, they become very weak. So that gives you that slims you that give you that very nice contouring of the jaw. And we do that a lot. Also, it's kind of it's a lot of indications.
I love it. That's one of my favorite things because I've always had a round face, and when I smile, I get chubby all of a sudden. So it definitely
but also it relaxes you. Also, it relaxes your face. You don't have that muscle that contracting over your face. It relaxes your face also.
I used to be such an intense smiler when I was younger, so it just like, it kind of, I feel like over time it really built up. But the last few years I had, the last time I saw you actually did treat me for that. But I hadn't had it done in over maybe a year and a half or so. So it was really nice to finally get that to relax and, coming back down. I had another question about your filler. I know that I've just had rhinoplasty done. I just did my second. I'm very open about it too. I just had my second surgery because the first one didn't go very well. I had my second one done. Now, a lot of people don't know that there is an alternative to surgical rhinoplasty. And this is something that you can do at your facility, at your location in Tustin, is basically giving a shape to a nose, kind of like almost like a nose job.
Yeah. So we're talking about like rhinoplasty, filler rhinoplasty. You can actually fix your nose by filler. Yes, actually, in fact, it turned out about 70% of the patients they can do filler, rhinoplasty filler. They don't have to do surgery.
Okay.
Not like they will fix about 70%, not everything. But like for example, you don't have to go for surgery. If it's just like a little bit, you can just fix it. Of course, you may go for surgery if your nose is like kind of destroyed, or there is a what we call a deviation of the septum, septum deviations, all that. Kind of. But if it's just for the shaping, you don't need to go for surgery. So if you look at my videos, I did a lot of filler rhinoplasty. I can fix the nostrils, the tip of the nose, like the tip over here up at the top is all you can do fillers. So people will tell me how long the fillers will last. I will probably will last about between a year and 2 years. But if I do surgery, but also when you do nose surgery is not an easy. It can turn out, it's one of the most difficult surgeries. So kind of when you do like a nose surgery, you may end up with complications. Kind of
Yeah.
it's not like okay, because a lot of, I'll be honest with you, because the nose, we don't have that much cartilage
Mm-hmm.
in our nose. So any kind of and also there is not that much vascularization in our cartilage over here. So the cartilage can die very fast and very tiny.
Okay.
It's all the time good. Like if it's no surgical, it's all the time good to try filler over surgery. But of course, there is indication for surgery also.
Yeah.
Now,
I
now,
agree.
doctor, sorry,
No,
a procedure like that, if you're doing like filler for nose, like how long is that type of a procedure? Is that a couple hours? Does that take an hour?
Yeah,
What's
be
it like?
honest with you, it's not much, but half an hour for like
Wow.
a rhinoplasty, but half an hour. It's not that long.
Okay, because I think a lot of people, I mean, that's one of the questions I always get when we do these is like, oh, how long does that take? You know, what kind of time frame or downtime or anything like
Well,
that? What
actually,
is the downtime on something? Or is there even downtime?
so there is no downtime. Like for fillers, there is no downtime. And I've been doing this rhinoplasty for fillers. People have been happy with it. And like I say, not everybody needs surgery. So like some people, they need just like a little bit kind of shape. You don't need surgery for that. But definitely there is surgeries for some of it. If it's like I said earlier, there's a broken cartilage or septum deviations or something like, affecting your breathing, what it is. Because,
Yeah.
sometimes when the cartilage affect your breathing, or actually sometimes if your septum is deviated, may cause allergies for you, kind of, like kind of, causing allergies or anything like that. That's surgery. But if it's not, then probably filler, uh, no downtime, no complications, and it's better. It's better like alternative for surgery.
I would have to agree, and
Now, doctor,
I speak firsthand experience with the
Yeah,
complications to the nose.
yeah. It's kind of a little bit not easy. Yeah.
Yeah.
is this something you can do consultation like this though for those, or is that something you have to see somebody inside your facility, a one-on-one consultation?
I can do virtual consultation, but also of course you do first virtual consultation, but also I can all the time see them in the office, for make sure that all the time, like with this COVID-19, we can all the time do virtual consultation, and then we can I can see the patient in the office. That gives me their idea how nose looks and how can I do. But definitely it's both. It's virtual consultation, then office consultation.
I have one last question. You know how as you age, your knees start to kind of get a little bit wrinkly and stuff. So, is there any Botox or filler alternative to help prevent the wrinkling over your kneecaps?
The wrinkle over the cap. Okay. Yeah. That's believe it or not, I do on the caps we do pedio threads.
You do
Like
peanut threads, okay?
we do pedio threads of wrinkling in there. It's good because it builds your own collagen. Also, it stretches up your calves over there. There's a big threads that we do over there, which is great, which is kind of a little bit lifted, but at the same time build your own collagen, because those threads, when they get this, when they dissolve, so basically they build your own collagen. So threads in there are really good over there.
I
Wow.
love that. That's going to be our next topic, because there have been questions about the PDO threads and the smooth threads. So I definitely want to do a whole episode on that. Is there any other places on your body that you could get Botox and fillers?
Yeah, I was like, actually, yeah, that's good questions. There is you can give Botox in your neck, the platysma of the neck. When your neck start getting a little bit of, kind of wrinkly, they start give Botox or platysma of the neck. So when they're like that, so you give them in those muscles all of the neck. So you can, it's really very good for the neck. Also, if you remember, we did give Botox for kind of a little bit for the lips. We call flip flap. So
Yeah.
basically, it relax your muscles, makes your lips a little bit bigger on the top.
Lip flip.
You know, that's, we give it the muscle over there because you know, ori muscles,
Mm-hmm.
kind of around your mouth in there, the muscles in there. So basically, it causes your lips flip flop a little bit, and it gets bigger. Yeah.
I
And
really,
also, and also sometimes some people they have this we call marinate line. So we give the muscle over there. They call it depressor unguli oris. So the muscle. So we give it gives that. So we give around here. So basically, patient will have those marinate lines. So and the muscle it's called depressor unguli oris around this area. Also, we give a Botox to the mentalis. You know, some people they have their chin, cranky chins, like kind of it's a little bit of you know, the dimpling of your chin, a lot of dimpling in your chin and there. So to relax your muscles, we give it over here to the mentalis of the muscle.
Yeah, I actually got that done. The doctor, you did that to my chin as well.
Yeah, so to relax your chin. So it gives the marinate line, it gives around your lips over there. It gives you this marinate lines. It gives the contour in your jaw. It gives you the muscle to your jaw. It gives you the migraine headache. It gets also to your neck. So all those are you can give Botox, like underarm for sweating your palms also. Any place for underarms. Let me see if we forget anything. Yeah, and also you can give you have to give you can give Botox under your eye, but you have to be very careful. So there is some people they have the crappy eyes under the eye. You can give it. The only thing you have to be very careful under the eye. There is some wrinkling under the eye, so you can give that also over there.
Okay, so it prevents the wrinkling under the
inside the crow's feet. You know, you can give it like here under the. Just in here, you have to be very careful because if you give it, you're not careful in their eye, you can give some bleeding under the eye because there's a lot of vascularization here, and you can give like black. We call black eyes, like you are like boxing with somebody. That happening. You know, with black eyes, man, it's like really bad because it takes about 3 months to resolve.
Oh,
So,
wow.
know, that's why when you see people boxing, the first thing they start like swelling is the under the eye, because over here in this area, it's very vascularized the area. Like,
okay. You have to be very, very careful.
Yeah, very easy.
Okay. Well, that's great. I definitely learned something new today. I knew a few stuff like the sweaty palms and the armpits.
Yeah.
I'm intrigued that you can treat the knee wrinkling with PDO threads. I want to learn more about that. I think there's a lot of women that want to learn more about that as well. So we're gonna save that for the next episode. Is there any
and also Botox, like I just I forgot about it. You know, you can do eyebrow lift with Botox. You know that?
Yes.
Yeah. So you can like you give in this area, and muscles, and do the eyebrow lift also with the Botox.
That's also my favorite too. I want to learn the price.
And you do in here and give some eyebrow lift with Botox.
I don't mind it. See, my right eyebrow is naturally more droopy than my left. So like it makes my eyes look uneven. Anyways.
Yeah, and I forgot to tell you about something. You know, you can give your Botox to your nose, nasalis muscles in here. Did you know that?
No. What is that for?
Well, I forgot to tell you. There is a Botox in here. You give it to the nasalis muscle. Like there is a muscles in here. They call it nasalis muscle, and there is muscles in here. They call it transversal nasalis muscles in here. There is one muscle is responsible over here for when you smile, your tip of your nose goes down.
Oh, it falls. Yeah, I've seen
it down. Some people when they smile, they go down. If you give it around this here, so actually lift it up. Also, there is also another muscles in here for the nostrils over there for our nostrils. When you smile, some people they dilate. When they smile, some people their nostrils get very dilated, they get bigger. there is a dilator of the nostrils in here. So a lot of time when they smile get it big, we can give some just few Botox in here in the nostrils over there. So when you smile, your nostrils doesn't get bigger, already. So there is two muscles in nasal. So you either can give it to make your tip of the nose goes up, or you can make your nostrils smaller than getting bigger. So actually you can fix just the nostrils and the tip of your nose.
That is so crazy. I actually didn't know that.
Yeah. So, but we don't talk about of course, the posterior area, that when you give Botox in this area, all your face is go ups in there. It's like very nice for the front areas.
Yeah.
But there's also for nasals over here, kind of like I say, if when you smile, your tip of the nose goes down, you can give it, or your nostrils, dilators, they get smaller. Plus, we also, there's a muscle around here we call the bunny smile. So when we get bunny in here, some people, they smile and they have what we call the bunny smiles, wrinkles in their nose. So we can give it also over there on the top, the tip of your nose.
That is amazing. I've had an Asian nose my entire life, and all of a sudden, I have a different nose. I don't know what to call this, but I actually have a nose now. So I've never really had those issues, but it's very interesting to find out.
Yeah, because some people, when they smile, are okay, big nostrils, like, because it dilates. When you smile, when you start like exaggeration, there is a muscle in here they call nostril dilators. So when you stop it, so your nostrils don't go big. I'm telling you, if you are really annoyed by whatever it is. If you're not, you don't have that. Annoyed by your nostrils, how they dilate, but I'm telling you all the indication. I'm not telling you have to do it, but I'm telling you all the indication for the Botox.
Okay.
That's our subject today.
Yes.
So you can, as long as you know where the muscles are, you can give it. But remember, whatever I told you, there is a jaw contouring, there is neck, but you have to be very careful where you give it. You can give, for example, the Botox around this area over there, because here there is zygomatic muscles make you smile, like that. If you give it in here, you may stop smiling. If you give in here, you don't give in here, you may call like cerebral palsy, like, because when you smile, it's like that. If you give it around down here, if you give it to the jaw, and let's say you give it to the jaw and you go up a little bit, there's muscles also around this area over there. So if you get close, so it will stop you from smiling, or sometimes you may feel like you're having stroke. So you have to make sure you don't give it to the muscle that you don't want to give it to.
Yeah.
Okay. No, that all makes sense. I mean, definitely.
Yeah. So it doesn't mean if I tell you go with all your face, you're gonna get that. You're gonna get that Botox and give it, because we have to keep our smile going. Because, like I said, if you give it to one area, or like we give it to, like sometimes what I talk about the bottom lines, if you give it one more than the other one, so your smile will be like doing like that. Because that one you stop it, or you give it to the muscle smiling, because there is a muscle in there, like smiling. You give it. So one will push up, one is not, or your muscles in there. So we have to give it to the muscles that the one not affecting your emotion, your facials, and your facials movement. That's very important.
That's very important.
Yeah, that's very important. One thing I forgot also about the Botox. You can also, what we call, you give Botox wrinkles on your chest. They call it décolleté injection. Décolleté. There's some patients, they have some wrinkles in their chest around, like when you open up with the sun, and we call the wrinkles on their chest, and we give it like décolleté around this area. We call décolleté injection. So if people, they have wrinkles around there, so you can give a Botox also in your chest. And we call it décolleté injection.
I really like this topic. That's stuff that I didn't know, that I think that's going to blow a lot of people away too. Because you can Botox just for your forehead, and just taking out wrinkles and stabilizing, your face. But you don't know all these extra stuff that
Yeah,
can
yeah.
benefit
Especially
your
like
body.
women, you see some women, they do like kind of a little bit of, they have some little bit of wrinkles on their chest.
Uh-huh.
So you inject over there, and it's, you know, kind of, we call it like for décolleté injection. It gets the wrinkle away.
That's amazing. I love that there's so many things that you can do. I didn't know that there were so many benefits. Eugene, did you have any more questions?
No, yeah, this is all so interesting. I'm just only hearing, think of Botox like right here, whatnot.
No, it's everywhere.
So,
every muscle you can give Botox in every muscles. You feel like it's shrinking, neck, chest, nose, everywhere. It just like I said, you have to know your anatomy. You cannot just give it. So, for example, you cannot give it, especially for areas where your facial movement. That's
got
very.
it.
Okay.
Well, thank you very much, doctor. This was all good information. I'm sure we're going to get some good feedback with this. Again, under this video, we will have all the contact information if people would like to reach out to you. Dr. Assif, thank you once again.
Sure.
Angela, thank you again for helping us gather some questions from the people in the audience. And my name is Eugene. And until next time, you guys, if you guys have any questions for any of us or Dr. Assif, please message one of us or comment in the video below. So,
Okay. Sounds great.
See you guys later. Thank you.
Thank you.
Okay.